Hello, my name's Terry Hess. As a podiatrist since 1993, I've always wanted to help our patients. The last 5 years or so, I've wanted to help us, the podiatrists, to make it better since these times are changing so rapidly, and now with COVID, even more rapidly. So my plan is to try to reach out and help all of us that I can to make it better, especially on the other side of what's coming our way, because I really think we have an opportunity to do a better job than we've ever done through telemedicine and just forward thinking.
I have a question for Kym. If we're doing a video, we should be using the E&M CPT codes and not the 99441. That is just for telephone only?
The telephone is for, the telephone E&M codes were the ones that were previously used for just a phone call. But as of 2 days ago, they do want us using the 99201 through 215 series.
Okay,
for
so
phone call
or audio or video.
Yes.
Okay, so when would we use the 99441? Are they
don't use
them at all? Okay.
Mm-mm.
Okay, thank you.
I also have a question for Kym. How do you document the check-ins, the G2012?
So what we are doing is basically making a new encounter and documenting that as like a phone note and putting all the details through there, so that way we have it to refer back to if ever audited. So it just says, like, I'm going to throw my doctor I work with, but Dr. Burkhart spoke to patient A at this time, discussed this condition, phone call or voice messaging lasted for, and then the amount of time that it was spent. We save that into their chart, and then that way we can continue to add on to it as needed to add up for the time.
Gotcha. So what if it's over multiple days? Do you just pick whatever the first day it was initiated on to create that chart? Yep. Okay.
Yep. Over 7 days you have.
Gotcha. Thanks.
It's easy if they have the portal and they're messaging you back and forth, because obviously those are timestamped and it shows the exact communications back and forth. But I know a lot of the patients will text you guys, they will call you guys on your personal phone, but that time of your guys is just as valuable. And that way you guys should be billing out for those things that you guys are spending your time doing.
Perfect. Do you also keep that as position 11, or do you do like position 2?
Nope, 11.
Thank you.
It seems like from 2 days ago, they want us moving away from place of service of 2.
The interesting thing, we did some math, and in the month of April, if we don't meet our new patient goal, because we get a new patient and then we see them, say, 5 times based on the treatment plan you enroll them into for plantar fascia, for a neuroma, for all those things, you're going to miss the 5 visits. So the vision I have ahead of us is June could be our worst month if April doesn't have enough new patients, because of that kind of flow, that momentum that gets created by new patients. So that's why we're trying as hard as we can to hit our current patients. Hey, your daughter has this condition, chances are you do too, mom, or the reverse. And that often is true. And so we're trying to invite them to become a patient, because this runs in the family. I know, Kym, is it Dr. Lehrman? Who's the guy that likes peds? Anyway, there's one podiatrist who only wants kids. And so he, no matter what adult he gets, he always says, you have to bring your kids in next visit for an appointment, and we'll get x-rays and baselines because we're going to prevent this from happening to them in the future. We're definitely not that good, but we're getting better.
We are contacting the primary care doctors around though, and letting them know that our office is open and we can get the patients in.
So I got a question. I'm not sure who would want to answer it exactly, but how's your protocol changed in terms of like, obviously with the safe distance thing, you can't treat feet and do that unless the person's over 6 feet tall. But what do you do in terms of the assistants that are actively treating and the doctors in terms of wearing masks in the exam room, things like that?
Kym?
You want to answer that one?
Okay. So with our limited stock of our masks, what we are doing is at this point, we assign one person a mask in the morning and we initial it. We're using it through the day. For the majority of our patients, obviously, you're assisting with holding the leg, with Una boots, that kind of thing. But other than that, you are down at the feet, so we just have them wear their masks and gloves and cleaning and sanitizing before and after with every patient. It does help too with us screening the patients before and their caregiver that comes with them at the door, because if they have any If they've got allergies, as a lot of them are stating, then we just hand them a mask at the front. So that also gives us a barrier between us and them as well. Does that help answer?
Yes, yes, it did.
Okay.
Is that kind of what you guys are doing?
Yeah, we did have one patient who, interesting things come out, that came into the room and informed us when she was in the room that her daughter had just returned from Italy and she'd had contact with him. And so we got the mask out real fast for her.
Yeah, I'll bet.
And but we wiped everything down twice that she had touched, you know. So we're trying to do, it's a good idea about the screening. We don't do that at the door, but we call all the patients the day before and we ask them, we tell them if you have a fever or anything, or if you develop it between now and when your appointment is, do not come in, reschedule.
Okay. If I walk in, they check my temp. I can't get in the building without being checked. That's the rule they have for no matter who goes into the building. So that's pretty helpful. And then I have to wash my hands in front of somebody, you know, so they're pushy, which is good.
Now, are you doing that in all your offices? Do you have one of those electronic temperature, you know, that you just hold up to the forehead?
We have different kinds of temporal ones, the regular ones. The temporal ones are the best, but you can't buy them right now. So
I'm sure, yeah.
We've also done some parking lot waiting room stuff where we've had, you know, patients that are really worried. We just have them wait out in the parking lot and call them whenever we're ready for them.
that's awesome.
One thing I just wanted to bring up is just an idea for you guys to think about of the patients that are canceling currently at your clinics. Make sure that you have some kind of Excel spreadsheet of who's canceling and then when their appointment was and what time, so that when things do ramp back up, you can start calling them and letting them know, and you're not losing the patient.
Thanks for watching. This is so important right now. We'd love to help. So please reach out to my CEO, Jolene, at jolene@anklefoot.net. And we'll do our best to reach back to help you guys through this crazy, crazy time. Thanks.